Good day, everyone. I am Clarigina Parada, and I am the representative reporter of Group 8, Reporter 6, under Chapter 3, Assessing Abnormalities. Our topic outline for today are neuropsychological tests, first. Second is the brain imaging techniques. Third is psychophysiological tests. And fourth is the projective test. And the last one is challenges in assessing abnormalities. And under this outline is there are three. We have the resistance and inability to provide information, evaluating children, and evaluating individuals across cultures. The intended learning outcomes. After the discussion, the students can first identify and explain the different assessment tools in assessing abnormality, and second, identify and explain the different challenges in assessing abnormality. First is the neuropsychological test and brain imaging techniques. So we have to define first neuropsychology, which is a specialty or a field that joins the medical fields of neurology, psychology, and psychiatry. So neuropsychology involves determining how well the brain is working when it is disrupted by a brain injury or a psychological disorder. It is also the study of the relationship between psychological actions and the physical structures of the brain. Neuropsychological tests are specifically designed tests used to measure a psychological function known to be linked to a particular brain structure or pathway. And these are a core component of the process of conducting your psychological assessment. First, we have a neuropsychological test called Bender Gestalt test or Bender Visual Motor Gestalt test. It is a psychological assessment instrument used to evaluate visual motor functioning and visual perception skills in both children and adults. Scores on this test are used to identify possible organic brain damage and the degree maturation of the nervous system. This test, or the Bender Gestalt test, was developed by psychiatrist Loretta Bender in the late 19th century. Brain imaging. So brain imaging techniques, we have types of brain imaging techniques, but before that, brain imaging refers to techniques that employ an interaction between brain tissue and various forms of energy. Example is the electromagnetic or particle radiation rather than physical incision to capture positional data about the structure and function of the brain. So there are four main types of brain imaging techniques, and the first one is the computerized tomography, or we can call it in some terms we call it CT scan. So a computerized CT, or a computerized X-ray imaging procedure in which a narrow beam of X-rays is aimed to a patient and quickly rotated around the body, producing signals that are processed by the machine's computer to generate cross-sectional images or slices of the body. That is the first. The second brain imaging technique, we have the positron emission tomography, or we call it the PET. PET is used to evaluate activity in different areas of the brain. So this test can assess some types of brain damage that affect the metabolism or the energy use of the brain. The next one is single photon emission computerized tomography, or we call it the SPECT, SPECT. It is an imaging test that shows how blood flows to tissues and organs. So unlike PET, this one focuses on the blood flows to tissues and organs in the body. The last one, we have the magnetic resonance imaging, or we simply call it the MRI. It refers to the imaging technique that uses a magnetic field. So this one uses magnetic field and computer-generated radio waves to create detailed images to the organs and tissues in the body. So MRI has two types. We have the structural and functional MRI. First, structural MRI refers to approaches that are specialized for the visualization and analysis of anatomical properties of the brain. That's why it's called structural, because it specializes on the visualization and analysis of the anatomical properties of the brain. Functional MRI, on the other hand, it identifies brain areas and underlying brain processes that are associated with performing a particular cognitive or behavioral task. That is functional MRI. So after your psychological test and brain imaging techniques, we have psychophysiological test and projective test. But first, let us look at the case of Phineas Gage. So if you are familiar with Phineas Gage, his case is very important on psychophysiological tests and projective tests. So in the mid-19th century, Phineas Gage is a railroad worker. So he was in charge of setting explosive charges for blasting through rock in order to prepare a path for railroad tracks. So he would lay the charge in a hole drilled into the rock and sometimes place a fuse and sand on top of the charge. And then he pack it all down using a tamping iron. So this tamping iron is a solid iron rod approximately 1 yard long and a little over an inch in diameter. So on a September afternoon in Gage's work, he was performing the task. He's stamping on iron coat, but this iron caused a spark that set off the explosive prematurely, sending the tamping iron flying through the air. Unfortunately for Gage, his head was above the hole, so the tamping iron entered the side of his face, passed behind his left eye, and exited out of the top of his head, so eventually landing 80 feet away. Gage lost a portion of his left frontal lobe in the accident but survived and lived for another 12 years, which is a very questionable one, and maybe some call miracle. But what is most interesting from a psychological perspective of this case is that Gage's personality changed as a result of this accident. So he became more impulsive, he had trouble carrying out plans, and at times he engaged in vulgar profanity, which was out of his character, of his normal character. So this case study leads one to believe that there are specific areas of the brain that are associated with certain psychological phenomena. So when studying psychology, the brain is indeed an interesting source of information. That is why it's very important. This case gave way to knowing that giving the belief that there are specific areas of the brain that are actually associated with certain psychological phenomena. So the first psychophysiological test that discuss is the EEG, and then we have the electrodermal response and the MEG. But first, let us know what is psychophysiological test. So psychophysiological tests are alternative method of CET, PET, SPECT or the SPECT and MRI used to detect changes in the brain and nervous system that reflect emotional and psychological changes. So, in short, psychophysiological test is an alternative method of brain imaging techniques. And psychophysiological measurement is also complex, powerful, and clinically useful assessment method in many assessment contexts and for many clients. It is amenable to geographic assessment, can also be applied in a time series format, and generates quantitative indices. So the validity of the obtained measures can be affected by electrode placement, site resistance, movement, instructional variables, time sampling parameters, data reduction and analysis, equipment, intrusiveness, and equipment failures. So in book if you will look for the book of Andres C. 1995 and Kakyu Paul and Tasinar 1990, it covers the instrumentation, measurement methods, technological innovations, clinical applications, and sources of measurement error. And if you will open again our book or module or PDF on uh, on tiers of personality, there was also discussion about this, so you can open it for a further information. But first, let me give you three psychophysiological tests. First one is the EEG or the electroencephalogram. EEG measures electrical activity along the scalp produced by the firing of specific neurons in the brain. So this technique uses at least 2 and sometimes up to 256 electrodes to measure the difference in electrical charge or the voltage between pairs of points in the head. So these electrodes or these voltage or the electrical charge are typically fastened to a flexible cap, similar if you have noticed or if you have seen one, it is similar to a swimming cap that is placed on the participant's head. So from the scalp, the electrodes measure the electrical activity that is naturally occurring within the brain. But EEG, in contrast to fMRI, measures neural activity directly rather than a correlate of that activity. Next is psychophysiological test. We have electrodermal response, formerly called galvanic skin response. So if you were to search electrodermal response, mostly most results will be galvanic skin response. So these two are the same. So electrodermal response or galvanic skin response is a sweat gland activity which can be assessed with a device that detects electrical conductivity between 2 points on the skin and which can also reflect emotional arousal. So if the EEG produced by the firing of specific neurons in the brain, so this electrodermal response is assessed with a device that detects electrical conductivity between 2 points of the brain and can also reflect emotional arousal. So GSR or the galvanic skin response is obtained by attaching 2 leads. If the EEG uses a flexible cap or similar to a swimming cap placed on a participant's head, so the GSR is obtained by attaching 2 leads. to the skin and acquiring a base measure. As an activity is performed, recordings are made from the leads. The last one is the magnetoencephalography or the MEG. MEG is another technique for non-invasively measuring neural activity. So MEG has the same excellent temporal resolution as EEG. Additionally, MEG is not susceptible to distortions from the skull and the scalp. MEG analytic strategies are nearly identical to those in EEG. However, MEG recording apparatus is much more expensive. That is why MEG is much less widely available. Now we have the projective test. Those are the psychological tests, the first three. Now we have the projective test. To know, proponents of projective tests argue that they are useful in uncovering issues or motives of a person, or in cases when the person is resistant or heavily biasing the information he or she represents to the assessor. But two of the most frequently used projective tests are Rorschach ink blot test and thematic apperception test. So these two, will discuss these two because it's the most frequently or most used projective test. First is the Rorschach ink blot test. This projective test often appears in popular culture and is frequently portrayed as a way of revealing a person's unconscious thoughts, motives, or desires. However, though the ink blot test may not be a perfect tool, it continues to be used widely. So it's very popular in clinical and particularly for diagnosing schizophrenia, which was Rorschach's original intent for the test. So the developer, or the one who created the Rorschach ink blot test, is Hermann Rorschach. So let me tell you about Hermann Rorschach. So Hermann Rorschach's favorite games as a child was colexography. So this game actually involves creating ink blots and making up stories or poems about them. So Hermann enjoyed the game so much that his school friends even nicknamed him Klex, which is the German word for ink blot. His interest in ink blots continued into adulthood. So while he was working in a psychiatric hospital, Rorschach noticed that patients with schizophrenia responded to the blots differently from patients with other diagnoses. So because of this reason, he began wondering if ink blots could be used to create profiles for different mental disorders. Ink blot test actually involves certain steps. The first step is the present, or in this test, the examiner will give you one card at a time and ask you questions like, what might this be? The second step is the respond. So after the examiner will give you one card and ask you, so you're free in this step, you're free to interpret the ambiguous image however you want. So you can take however long you like to interpret each card and can give as many responses as you want. You can also hold the cards in any position, whether it is upside down or sideways. After the respond, the third step is the record. So your examiner records everything you say, no matter how trivial. So they'll note the time taken for each responses, and not just about the words that comes out of your mouth, but also the position the card is being held, your emotional expressions. They will record it, and etc. during the test. So the fourth step, or the last step, is confirm. After the record, once you go through all the ink blots once, your examiner will take you through each ink blot a second time. So the goal of this is not to get new information, but to help your examiner see what you see. So this is to confirm. They're gonna ask you to identify where you see what you originally saw and what features make it look like that. So after the Rorschach ink blot test, the second one is the thematic apperception test, or the TAT. It is a type of projective test that involves describing ambiguous scenes. This is also popularly known as the picture interpretation technique. It was developed by American psychologists Henry A. Murray and Christiana D. Morgan at Harvard University in the 1930s. Actually, the complete version of the TAT includes 31 cards. Murray originally recommended using approximately 20 cards only and selecting those that depicted characters similar to the subject. But today, many practitioners only utilize between 5 and 12 cards, often selected because the examiner feels that the scene matches the client's needs and situation. The TAT, or the thematic perception test, involved showing people a series of picture cards depicting a variety of ambiguous characters. So these ambiguous characters may include men, women, and or children, scenes, and situations. So they are then asked to tell as dramatic a story as they can for each picture presented. So including the information like what has led up to the event show, what is happening in the scene, the thoughts and feelings of characters, and the outcome of the story. So those are type of test in assessing abnormalities. But first, we have to know that there are challenges in assessing abnormalities when using the different tests. So, because abnormal behavior is a combination of personal distress, psychological dysfunction, deviance from social norms, dangerousness to self and others, and costliness to society. Some challenges that arise in assessing people's problems include people's inability to provide information or resistance to providing information. In addition, special challenges arise when evaluating children and people from cultures different from that of the assessor. Psychologists and other mental health professionals use clinical interviews and a variety of other means to assess abnormal behavior, including psychological testing, behavioral assessment, and physiological monitoring. The first challenge is in methods of assessment. Today, clinicians use different methods of assessment to arrive at diagnosis, including interviews, psychological testing, self-report questionnaires, behavioral measures, and physiological measures. So the role of assessment is very important. However, goes further than classification. A careful assessment provides a wealth of information about clients' personalities and cognitive functioning. This information, the assessment, helps clinicians acquire a broader understanding of their clients' problems and recommend appropriate forms of treatment. In most cases, the formal assessment involves one or more clinical interviews with the client, leading to a diagnostic impression and a treatment plan. In some cases, more formal psychological testing probes that clients' psychological problems and intellectual, personality, and neuropsychological functioning. The second challenge it would be about resistance and inability to provide information. So one of the greatest challenges to obtaining valid information from an individual can be his or her resistance to providing information. So the individual can resist or can even provide the information at hand. But sometimes the person does not want to be assessed or treated. Even when a person is not completely resistant to being assessed, rather, he or she may have strong interest in the outcome of the assessment and thus may be highly selective in the information he or she provides. So not information will be provided by the individual you are assessing. So it may bias his or her presentation of the information or may even lie to the assessor. Such problem often arises when assessments are being done as part of legal case. Third challenge would be evaluating children. So unlike adults, anyone who has tried to have a conversation with a distressed child about why he or she misbehaved has some sense of how difficult it can be engaged a child in a discussion about emotions or behaviors. As it said, adults can go further on discussing or conversing why he or she misbehaved, but it is very difficult for a child. Even when a child talks readily, his or her understanding of the causes of his or her behaviors or emotions may not be very well developed. Children, particularly preschool age children, cannot describe their feelings or associated events as easily as adults can. The third challenge would be evaluating individuals across cultures. So we all know that a number of challenges to assessment arise when there are significant cultural differences between the assessor and the person being assessed. Imagine having to obtain all the information needed to evaluate someone from a culture very different from your own. The very first problem of the assessor that he or she may run into is that the person may not speak your language or may speak it only partially, or you may not speak his or her language at all. Symptoms can be both underdiagnosed or overdiagnosed when the individual and the assessor do not share a language or the same language. So that could be all from our group. Again, the topic is all about neuropsychological tests and brain imaging techniques. We have the psychophysiological test and projective test, and the last is the challenges in assessing abnormalities.